Intestinal polyps are of two types, non-neoplastic and neoplastic. Non-neoplastic, there are of three types, hamartomatous, hyperplastic and inflammatory. Inflammatory, it often presents as a solitary rectal ulcer. Coming to neoplastic, there is only one type, that is adenoma, adenomatous intestinal polyp. It always show dysplasia. Anaplasia may be present or may not be present. Now let us discuss the non-neoplastic tumors, mainly the hamartomatous polyps. Hamartomatous polyps is very important topic. The hamartomatous polyps, mainly it is of two types. First we will learn about the main two types, and later we will learn about the syndromes which are associated with hamartomatous polyps. In hamartomatous polyps, the first type is called juvenile rectal polyposis. Juvenile, the name suggests that it occurs in juvenile age group, that is less than 5 years of the age. Rectal polyps is characteristic feature. Presentation is by the rectal bleed. The patient will show digital clubbing. Histopathologically, here we can see cystically dilated glands. These are abnormally large cystically dilated glands. See, here we can see the cyst. Genetics, we have SMAD4. SMAD4 is important. Along with SMAD4, SMAD2, BMPR1 are also important. So let us revise again. A 5-year-old child with rectal bleed and digital clubbing, histopathologically when you see a cystically dilated glands, it is 100% juvenile rectal polyposis. There is no other possible diagnosis for this. SMAD4 mutation is important. Now, the second type of hamartomatous polyp, that is Peutz-Jeghers polyp. Peutz-Jeghers polyp. See, juvenile rectal polyposis was 5 years of age. Here, Peutz-Jeghers polyp, it usually occurs in 5 to 15 years of the age. Usually 11 years is what we say. So, Peutz-Jeghers polyp, 5 to 15 years of the age. Juvenile polyp, jejunum is the site. Jejunal polyps, 5 to 15-year-old jejunal polyps. Presentation is abdominal pain. Previously in juvenile rectal polyposis, rectal bleed. Here abdominal pain with jejunal polyps. In jejunum, as the polyps are present, there is a risk of intussusception. Along with the jejunal polyps, in Peutz-Jeghers syndrome, it is syndrome, so it has other features as well. So the person will show mucocutaneous pigmentation. Here you can see the lips are pigmented darkly in the Peutz-Jeghers syndrome. So mucocutaneous junction pigmentation, jejunal polyps. Microscopically, arborizing pattern or branching tree pattern is seen. Here you can note one thing, that the branches of the tree, which I am marking with a yellow color, these are made up of smooth muscle. Smooth muscle enlargement is seen in the Peutz-Jeghers syndrome. Coming to the genetics, Peutz-Jeghers syndrome will show STK11. STK11 gene mutation is important. Apart from this STK11, LKB1 mutation. STK11 and LKB1 mutation is very important for Peutz-Jeghers syndrome. Arborizing or Xmas tree pattern microscopically is very characteristic feature, smooth muscle hypertrophy. Along with juvenile rectal polyposis and Peutz-Jeghers syndrome, the hamartomatous polyps, Hamartomatous polyps can also be seen in Cowden syndrome. They can be seen in the Cowden syndrome, Banyan-Ruval-Kaba relay syndrome, tuberous sclerosis, Cronkite-Canada syndrome. So these four syndromes can also show Hamartomatous polyp association. Now let us learn about the individual syndromes. Cowden syndrome. Cowden syndrome, it shows P10 gene mutation. P10 gene is present on chromosome 10. Now, how to remember the features of Cowden syndrome? I will remember with a simple trick that an single cow which doesn't have any partner is present inside the den. It keeps on eating the food, and after eating a lot of food, uh, it has to be absorbed. So the intestine will show polyps, so as to increase the absorption area, surface area. So a cow in a den eating a lot because it doesn't have a partner due to stress eating, it has polyps in the intestine. Due to excess eating, it has excess milk production, so that the breast in cow is nothing but the udders of the cow from where the milk comes, right? So the breast of the cow will get the cancer. Due to excess eating, the polyps in the intestine is seen, breast will show cancer, and because of the cancer, immunity is decreased. So tricholemoma, a hair disease is seen. The all the hair on that cow will get affected. Apart from that, it will have endometrial cancer and thyroid cancer. So let us remember it again. A single cow sitting in a den keep on eating the food. To absorb more food, polyps in the intestine are developed so as to increase the absorption area. Now the milk production is increased, so the breast will show cancer due to excess growth. After that, the hair also will show excess growth, so tricholemoma is seen. Finally, the endometrium and thyroid glands of the cow will also show the cancer, because the breast is showing the cancer. Why shouldn't we show the cancer? So egoistically, the endometrium and thyroid glands of the cow also showed the cancers. Finally, this is all about the Cowden syndrome. Now let us jump into the other three simple syndromes. They are very simple. Banyan-Ruval-Kaba relay syndrome. Here, this syndrome is also associated with P10 gene mutation. In Banyan-Ruval-Kaba relay syndrome, there are only two features mainly: polyps in the intestine, that is Hamartomatous polyps, and mental retardation. How to remember this? Banyan-Ruval-Kaba relay syndrome. This is really very lengthy name, and Ruval-Kaba relay, banyan tree, Ruval relay. These all things will mess your mind. So that person, Banyan-Ruval-Kaba relay syndrome, will have mental retardation. So polyp in the intestine and mental retardation is the feature of Banyan-Ruval-Kaba relay syndrome. P10 is the mutation, chromosome 10. Next, tuberous sclerosis, TSC1 and TSC2 are the genes. TSC1 is present on the chromosome 9, TSC2 is present on chromosome 16. The features: Hamartomatous polyps are seen, and rhabdomyoma. This is a tumor which is a benign tumor in the left ventricle in the children. So tuberous sclerosis, remember two things: Hamartomatous polyps and left ventricular benign tumor, that is rhabdomyoma, TSC1, TSC2, chromosome 9 and chromosome 16 respectively. Now Cronkite-Canada syndrome. Cronkite-Canada syndrome. How to remember this? If you do not get the permanent residency in the Canada hereditarily, you have to wait and write exams like IELTS and other things. You have to stress a lot for the visa to Canada, Cronkite. So you have to take an exam called Cronkite to get into the Canada. It nearly takes more than 50 years of the training to enter the Canada. So it is non-hereditary because you didn't get the visa from your father. For 50 years you wrote an exam called Cronkite, because of which you finally got the visa to Canada, but you developed polyps in the intestine, your hair got lost, nails got atrophied, and suddenly you got shifted to Canada. So temperature change showed you a great pigmentation, skin pigmentation. So this is all about hamartomatous polyps. Now let us learn about adenomas. Adenomas are histologically of three types. One type is the first image which you are seeing. This is tubular, this is villus, and this is tubulovillus. Tubular, villus, and tubulovillus are three histological varieties of adenomas. See, in tubular variety of adenoma, there are tubules, there are round glands. Here you can see the round glands. These tubules are seen in tubular variety of adenoma. In villus variety, there are large villi, finger-shaped projections. There are no tubules. Here you cannot see any tubules. So this is villus variety. And now in tubulovillus form, here you can see large villi and the cysts, the tubules also. Tubules are present and villi are also present. Tubular, villus and tubulovillus, three types are seen in adenoma. And here one point to be noted is that the size of adenoma, if the size increases, there is risk of malignancy also increases. And among three histological types of adenomas, villus adenoma has maximum risk of malignancy. Now let us learn about FAP, familial adenomatous polyposis. The genetic mutation is APC gene mutation. Here APC gene is present on 5q21, fifth chromosome, Q arm 21. 5q21 APC gene FAP. In FAP, more than 100 polyps should be present in the intestine. Then only we can call it FAP. If more than 100% of the more than 100 polyps are present, then there is 100% risk of cancer. This is FAP, APC mutation. If APC mutation is not present in familial adenomatous polyposis, then some other mutations like microsatellite mutations, which increase the telomerase activity or overactivity of telomerase, can be seen. They are MSH, MSI, MLH, MY. M refers to the microsatellite mutations. These satellite mutations can also occur in the FAP. Then in such case, when APC mutations are not present and the MSH mutations are present, then that FAP is called as attenuated FAP. In attenuated FAP, there is no rule that only 100 polyps should be present. 40 to 60 polyps can also be sufficient to diagnose the attenuated FAP. 40 to 60 polyps, attenuated FAP, FAP 100 polyps. FAP with APC mutation 100 polyps, FAP without APC mutation 40 to 60 polyps. See, in FAP, prophylactically, when you notice more than 100 polyps in the colon, you have to do the colectomy. Removing the colectomy reduces the risk of cancer. Not only in the colon, it will also reduce the risk of cancer in in organs other than intestine. In extraintestinal organs also, the risk of cancer is reduced by doing the colectomy. If the colectomy is not performed in FAP, the person will develop carcinoma. Now, FAP is of three types, that is classical FAP, Turcot syndrome, and Gardner syndrome. Remember, in classical FAP, there is congenital hypertrophy of retinal pigmented epithelium. Retinal pigment epithelium is hypertrophied in classical FAP. So, in classical FAP, polyp plus pigment epithelium of the retina gets hypertrophied. Next, in Turcot syndrome, listening to the word Turcot, we can remember the word turban. Turban is placed on the brain. So, medulloblastoma and glioblastoma, along with FAP, together called as Turcot syndrome. In Gardner syndrome, remember a gardener who doesn't have teeth, unerupted teeth, which are many in number, supernumerary teeth with multiple unerupted teeth, and he also has multiple osteoma, desmoid tumor, sebaceous cyst and fibroma. All these findings are seen in Gardner syndrome. So, repeat once again: Gardner syndrome, multiple osteoma, desmoid tumor, unerupted supernumerary teeth, sebaceous cyst and fibroma. Let us arrange in an orderly manner. Skin, sebaceous cyst is seen. So, next, below the skin, fibroma is seen. Next, below that, bone is seen. So, multiple osteoma. Multiple osteoma can occur in the skull or any other bone. Next, desmoid tumor. Next, unerupted teeth. All these features will add Gardner syndrome. Now we discuss the Gardner syndrome. Let us discuss the adenoma carcinoma sequence. This is important. Here, a normal mucosa undergoes hypertrophy to form the early adenoma, which further on mutations will show intermediate adenoma and then late adenoma, finally carcinoma. Okay, we are clear with the sequence, right? Now let us learn the mutations. In normal mucosa, APC gene mutation will occur first. The proto-oncogene is beta-catenin. Proto-oncogene beta-catenin, APC is the tumor gene. Next, from early to intermediate also the same mutations. APC mutation, beta-catenin mutation. From intermediate to late adenoma, here the oncogene mutations occur. That is KRAS and BRAF. These two mutations show the intermediate to late adenoma. These are oncogenes. Now finally, the late adenoma, it has two fates. One is the senescence. That means the cells will undergo apoptosis. One is the carcinoma. Late adenoma, if P53 gene, which is working, functioning P53, that is wild variety, normally wild variety, then senescence occur and carcinoma does not occur. But late adenoma, if P53 gene is mutated, then carcinoma occurs. Tumor marker for carcinoma of the intestine, is CEA, carcinoembryogenic antigen. CEA is the tumor marker, and radiologically we can see the apple core appearance in barium enema. Screening for carcinoma is done by GWAC test. It detects the occult blood or a minute quantity of blood in the stools of the patient. Radiologically, barium enema shows apple core appearance.